Hi, this is Mitch Mitchell of TT Mitchell Consulting Incorporated. I decided to do this as a video rather than to write something because I thought that the flow that I wanted to use worked a little bit better in a video than it would if I wrote it down. Here's the thing. I originally was going to call this post Healthcare and Social Media, and then I realized that that's not quite accurate. Let me explain a couple of things, or let me just bring a couple of things up. If you go to a search engine, don't care which one it is, and you type in Charge Master Consulting, one word or two words, and you put that in and you hit go or whatever that little thing is there, the magnifying glass, you're going to find that I come up in the top 5. Most of the time I come up number 2. If you put in revenue cycle consulting, you will usually find me in the top 5. If you put in New York, I'm number 1. I come up number 1 in New York State for revenue cycle consultant. I come up number 1 for charge master consulting and consultant and whatever one of those kinds of things. The reason that I bring that up is because in social media, or rather on the internet, when you're creating websites and you're doing something that they call search engine optimization, you strive to get certain search terms for things that you do specifically into at least the first page of Google. The higher up you are, the better opportunity you have to be engaged and to have people talk to you and make money and do whatever. So I've done what I needed to do for those specific search terms for my website. The website's ranked nicely. I've got a blog where I talk about healthcare as well as leadership issues. So I've done everything I need to do. And you would think that my phone would be ringing off the hook. It doesn't happen. I don't know why it doesn't happen. Actually, I said that, and that's not quite true. I do know why. It's because when I'm trying to get work in healthcare providers don't really understand the internet. They don't understand social media. Now, I make a blanket statement like that, and someone's going to say, oh, sure we do. We have a website. You have a website. Let me tell you, your website basically stinks. Yeah, I'm going to tell you that. I look at healthcare websites every day. I look at a lot of them. I do that because part of the marketing that I try to do is to make phone calls to chief financial officers or vice presidents of finance, and so I have to go online and look for the information so I can find phone numbers. So I look at a lot of hospital websites. And you know what? They're not ranked well at all. Most of them are terrible. Most of them don't understand search engine optimization. They don't understand title tags. They don't understand keyword phrases or anything like that. They don't, really put a lot of emphasis into having all their other pages kind of link back to the first page. They don't have forums. Most of them don't have a way for a person to pay their bill online via credit card or, from their checking account. They don't have a blog. They don't have a leader blog. They're missing all of that. It's like the old days of healthcare. Now, I've been in healthcare since 1983. And pretty much if you were the only hospital in town, you're it. You're the game. You don't really do a lot of advertising because you figure, we've got everybody. You're going to come here. Well, that still holds true a lot, but not so much anymore, because what you'll find is that the bigger city hospitals are advertising and they are marketing because they have competitors within their own hometown. And you know what? Those commercials are reaching your audience. Anywhere within pretty much 45 minutes to an hour from where I am right now, and I'm in the Syracuse, New York area, our TV stations are in those areas. So those people actually have to compete with the hospitals in the Syracuse area for an audience. You get the same thing in the Rochester area. The Rochester area hospitals advertise, and their ads are being seen on the regular TV, and then the smaller community hospitals aren't advertising at all, or probably aren't advertising all that much. And they're getting beaten. So I'm talking about advertising, and let's get back to internet and social media. One of the things that I tell people through some other services that I provide in social media and search engine optimization is that you're going to have to learn how to be found on the internet before everyone else. You're going to have to learn how to engage. This is the way the world is going. I mean, we have Facebook now that has over 900 million people. You have LinkedIn. I mean, this is for professionals. And it has at least 50 to 100 million people now. Obviously, you have Twitter. And I got to tell you, hospitals, physicians' offices, and the like, you're all missing out. Now, from my standpoint, I'm missing out as well because it doesn't really do me a heck of a lot of good trying to market to you and advertise to you and get up as high as I can in the search engines if you're not looking. Now, to your credit, probably some of your human resource departments have tried to figure things out and are going to look up on Facebook and some of these other things to find out what potential employees might be doing online. Some of them are doing that. Some of them are asking people for their Facebook passwords and the like. That's illegal, by the way. If they wanted to call you on that, you'd probably have to face federal charges. Most people aren't doing it because of the unemployment rate, but just push someone a little bit too far. So if you're doing that, stop that. But, there needs to be this symbiosis. You can't have all these people working in the hospital who are afraid to be on the internet. CFOs, CEOs, directors, the information is out there. It's on the internet. It's in forums. I mean, my goodness, there's all kind of forums. Group I belong to, the American Association of Healthcare Administrative Management, or AHAM, we have a forum, and people ask questions and people answer questions. It's all geared towards healthcare. I'm sure HFMA has a forum. Everyone has at least heard of some of those groups or whatever. There is this movement. It's called the internet. It's been around for a long time. And if you're sitting there at your desk and you're saying you're too busy to go online and find out what's going on, then you're getting passed up. If you think that the best you can do is once a month go to an HFMA meeting to learn something about cost reports, then you're missing out on what's going on. If you haven't kept up with the ICD-10 thing that's coming, you're missing out. It's all on the internet. Everything is out there. If you're missing out on opportunities to connect with patients, to give patients the chance to connect back with you, you're going to get passed up. So this is just my little rant today, or a little statement on basically, like I said, healthcare and the internet. I can't even say social media. How many hospitals have a Facebook page? I just asked the questions. So there you go. Like I said, I'm Mitch Mitchell, TT Mitchell Consulting Incorporated. Stop by, check out my blog, see some other stuff I have. Send me an email, give me a phone call. Let's talk. Take care.